Welcome to Leeds Endoscopy units. We are one of the largest, most modern and advanced endoscopy units in the country. We have 3 busy endoscopy units, one at Wharfedale General Hospital, one in the Clarendon wing at Leeds General Infirmary and one in the Bexley wing at St James's Hospital. These are all modern purpose-built units. We have in total 10 endoscopy rooms in which are performed approximately 20,000 procedures a year. Here in Leeds, we are able to perform a wide variety of endoscopic procedures and treatments for digestive symptoms and diseases. Each unit is equipped with the latest state-of-the-art high-definition endoscopy equipment to ensure the optimum outcome from the procedure. Although we are in 3 units, we are one large team of dedicated nurses, doctors, managers and administrators. Nurses and endoscopists all rotate and work through all of the units to ensure we all work to the same standards. Wharfedale Endoscopy Unit is on the 2nd floor of the Wharfedale Hospital. It is a 2-roomed unit with the same facilities, endoscopists, equipment and clinical pathways that are used in the other 2 units in Leeds. Here we perform procedures exclusively for outpatients. Mostly these are diagnostic procedures, but some treatments can also be performed. Patients and their relatives often like the convenience of this smaller unit. The Leeds General Infirmary unit is located on B floor of Clarendon wing. It is a larger 4-roomed unit that serves both outpatients and inpatients on the LGI site. This is the location where bowel cancer screening procedures are performed in Leeds. The St James's Endoscopy unit is on the ground floor of Bexley wing. This is a busy 4-roomed unit that serves outpatients as well as the inpatients of gastroenterology, surgical and oncology wards of St James's, so the full range of therapeutic procedures are available and performed here. In Leeds, endoscopists may be medical doctors or surgeons, but we also have one of the largest teams of dedicated, highly trained nurse endoscopists who perform upper endoscopy, flexible sigmoidoscopy and colonoscopy, including bowel cancer screening. We offer an extremely broad range of procedures. Diagnostic tests such as endoscopy, also known as gastroscopy, or colonoscopy are performed to look into the causes of symptoms from the digestive tract, monitor existing conditions, or as part of a national cancer screening programme. We also perform a wide variety of treatments using endoscopes, such as opening up narrowed segments of the intestine, called dilatation, removing polyps, treating early cancers, and treating areas of bleeding. We have an on-call team available 24 hours a day to diagnose and treat all causes of intestinal bleeding. At LGI, we perform endoscopy of the small bowel, either with a capsule test or specially designed endoscopes called an enteroscope. At St James's, we also have equipment to perform endoscopic ultrasound, where a scanner is at the tip of the endoscope. This allows us to see deeper into and beyond the layers of the intestine. We also perform endoscopy of the bile duct and pancreas called ERCP. We have the latest digital spyglass technology which allows us to pass a miniature endoscope into the pancreas, bile duct and liver. In Leeds, your safety and comfort are our priority. On the day of your procedure, we perform many checks before, during and afterwards to ensure your safety. Please watch our other video to understand the process of having an endoscopy. Each endoscope is carefully decontaminated after each use in dedicated areas within each unit to ensure that the endoscope is fully sterilised prior to any procedure. All other equipment is disposed of after a single use. At Leeds, teaching and research are an important part of our work. We have many trainee doctors and nurses learning endoscopy and run live endoscopy courses. We feel this is the best way to ensure best practice in Leeds and elsewhere. However, all trainees are closely supervised by experienced trainers, the Leeds Endoscopy philosophy. We know that endoscopy is a stressful procedure to have. During your time in Leeds Endoscopy, you will be looked after by our dedicated and highly trained nurses and doctors who will provide you with individualised care. However, if you have any queries before your procedure, do contact our pre-assessment team, whose details are on this website. In Leeds, our team philosophy is to make your experience as easy, safe and comfortable as possible, and to provide you with the best possible outcome after your endoscopy, whether it be your first procedure or one of many. Please do use the feedback forms on this website or in the department if you have any suggestions how we can improve our service.